Aspiration of IM Injections by Natalie Collins, Faith Crappy, Emily Fox, and Rachel Simoncelli. Aspiration of intramuscular injections has been taught in nursing schools for many years. Even though it is taught to be the standard of practice, why do most nurses not follow through in their professional careers? This problem is significant and relevant to nursing because despite this being a taught skill in school, the application of this practice in clinical practice remains lacking. Many nurses believe aspiration causes more pain to the patient during the injection, and that if you are in a blood vessel, you would see the blood without the need to pull back. If this is true, aspiration during an intramuscular injection should be rejected from the practice. Our research question was, in patients receiving intramuscular injections, do they have decreased pain sensations with injections not being aspirated compared to the pain level of those whose injections were aspirated? The first study we looked at was called Barriers and Facilitators to Injection Safety in Ambulatory Care Settings. The purpose of this study was to identify factors referred to as barriers and facilitators that can prevent or assist safe injection practices in ambulatory care settings to guide quality improvement. The findings of this study included barriers to safe injection administration, including persons, technology, organizations, tasks, and environments. Also, another finding was the knowledge of safe injection administration does not necessarily correlate to practice. This is relevant because it showed that there's a lack of consistency in administration of injections, enforcing the need for staff training programs to reinforce safety and reliability. This study is feasible because participants chose to be interviewed and observed. They also remained anonymous. The research was transcribed by 2 researchers aiding in the reliability. Some benefits of the study were that the observation of administration followed by the interviews allowed for gaps in practice and knowledge to be identified. The interviews gave diverse responses from the participants. Some risks of the study would be the biases that could not be eliminated to it because of the desire to give acceptable responses. Staff may have knowledge on the safe administration but chose to ignore it. The number of facilitators versus barriers discussed proves that this bias exists.
Synthesis 2, titled Blood Aspiration During IM Injection. Purpose of this study is to identify if the aspiration of IM injections is necessary in daily practice. Findings of the study is, while further research is needed, blood aspiration does happen in IM injections, thus nurses should use decision-making processes on whether the aspiration of IM injections should be used. This is irrelevant to nursing because despite this being a taught skill in school, the application of this skill in clinical practice remains lacking. Feasibility of this study was the same anonymous survey was given to all of the participants. 164 surveys were completed with a nursing facility in a state university. Benefits of the study was to decrease the risk to patient safety with IM injections. The risk is barriers to the study is that nursing behavior is difficult to change and implementation requires effort, training, and policies. Synthesis 3, titled Aspiration in Injections, Should We Continue or Abandon the Practice? The purpose of this article is to discover if the aspiration of intramuscular injections should be an accepted practice with the lack of evidence if this is beneficial. Findings: different medications and vaccines offer different risks, thus precautions should be taken when given more critical medications. There remains a shortage of consistent recommendations regarding aspiration. Relevance: by not aspirating critical medications, patients are being put at risk. For feasibility of this article, a literary review was conducted using the U.S. National Institute of Health's PubMed service, Archives of Signpost, the weekly electronic newsletter of the World Health Organization, Safe Injection Global Network, and International Organization of Standardization. Recommendations: 7886 Parts 1 through 4 for sterile hypodermics. Clarification on points of debate were sought by direct communication with ISO. Google Scholar was also used to search for relevant information. Benefits of the study was to decrease the risk to patient safety. The barriers to the study was that there is not enough research to definitely say if not aspirating an IM injection would be harmful to the patient.
The next synthesis was entitled What Practices Are Being Used by Staff Nursing to Ensure Safety in Injection Administration Among Patients. The purpose of this article was that the researchers used observational checklists, including safety protocols for intravenous and intramuscular injection techniques. This quantitative research study showed that 93.3% of staff nurses showed that they had good techniques for intramuscular injections. This study also revealed that there is no significant association of intramuscular and intravenous injection administration practices with age, gender, educational qualification, area of work, or work experiences. The relevance of this study is that safety is the key to caring for all patients. By analyzing the safety protocol, nurses are able to assess the well-being of all patients. The feasibility of this research article is that the researchers use the same observational checklist with all nurses, allowing consistency among research analysis. The benefits of this research is to ensure the optimal level of safety for patients and nurses during injection administration. The risk of this research is that the lack of safety protocols puts both nurses and patients at risk, and that instituting safety protocols requires extra spending and staff training. The final synthesis we analyzed was a systemic literature review. It was entitled Aspirating During the Intramuscular Injection Procedure. The purpose of this research study was to determine the habits of nurses during injection administration. These researchers found that the majority of healthcare professionals do not aspirate for the recommended 10 to 15 seconds, as it is less painful for those who are receiving the injections. Research conducted showed that there was not enough evidence to support for advocating for aspiration with IM injections, and that the lack of aspiration is partially due to the lack of policy in healthcare facilities. This is relevant to nursing as it shows that the lessons taught in school are not always the ones that are practiced. This literature review is feasible as it surveyed trained nurses working in multiple healthcare facilities who have administered intramuscular injections. The benefits for future nursing is to decrease the pain in patients and create a universal standard of taught and practiced injection techniques. The risk is that the barriers may be in training nurses who have adapted to aspiration techniques during IM injections.
Design plan. The proposed change should be discontinue the practice of aspiration with intramuscular injections. The research design was a comparative design. Resources. The facility that we used for this study is a primary care office during the flu shot season, and we decided that we would do it on Monday, Wednesday, and Friday. The first thing we would have to do is obtain consent, and then we were going to use the numerical and FACES pain rating scale to determine the amount of pain. Who are the stakeholders? In this study, nurses who administered intramuscular injections would be the stakeholders. This included the LPNs and RNs. How will the stakeholders be affected? The healthcare facilities will have to train the staff and implement change. There will also be a potential reduction in the patient-reported pain ratings. There will also be clarification on proper nursing injection administration. Implementation process. There are a few things that will have to be done to implement this properly. You first will have to develop safety policy for administration of intramuscular injections. You also will have to train the LPNs and the registered nurses on these new policies.
The healthcare facility training committees will also have to continue to implement this new policy. Measured outcomes and projected outcomes. The measured outcomes that we are going to be using are the pain scale ratings of the intramuscular injections and the training costs. The projected outcomes would be a decreased amount of pain with intramuscular injections. Implementation. As stated previously, the setting would be primary care offices. The sample population would be patients who receive injections during flu shot season, and the patients who are seen in the office on Monday, Wednesdays, and Fridays over a 6-month period. Evaluation. We are going to compare the pain ratings of those who experienced aspiration with injections and those who did not. We are going to use the numerical or the FACES pain rating scale depending on the age of the patient. The numerical will obviously be used for the older patients, and the FACES will be used for the younger population. Adapt, adopt, or reject. In order for us to adapt to this new policy, all nurses will have to be compliant with it. There also will need to be consistent training for all nursing staff, including those who are already working there and the new hires. Patients will also have to continue to report low pain ratings with the intramuscular injections. Integrate. To integrate this, we will have to develop policies highlighting research evidence and how it should be implemented into practice. We will also have to implement training procedures for the nursing staff and encourage continual research on this topic. Maintain and monitor. To maintain this new policy, patient pain rating using the numerical and FACES scales needs to be continued to be monitored. There also needs to be incorporation of nursing practice policy and training and orientation courses. Yearly seminars and newsletters to incorporate and reinstitute this practice in nursing is important as well. Here's a list of our references. I hope you enjoyed the presentation.